Everyone, welcome to this month's edition of the CHP Spotlight interview series. I am really excited because we are joined this month by Dr. Michael Antonis. Did I get that right?
Got it right.
Perfect. All right. And Dr. Antonis, he specializes in is a sports medicine specialist with OrthoVirginia. And actually, what's really exciting is he is the team physician for the Washington Commanders, previously served as the team physician for DC United, Loudoun United for 5 years. So it's a wealth of knowledge, tons of incredible experiences. So Dr. Antonis, thank you so much for joining us today.
Well, I appreciate it, Zach. It's always good talking to you. We share a lot of patients back and forth, and I could say for all the experience I have, you have very similar experience, and our patients do well bouncing back and forth between us and coming up with a great plan.
Yeah, well, we're always excited to collaborate, and hopefully everybody here can see sort of the communication that happens a little bit behind the scenes, and how we like to communicate about in regards to just helping people and helping patients. So, with that being said, I'd love to hear for everybody else out here to hear a little bit about what you do, because I know you have a unique approach to patient care, especially from that non-surgical perspective. I'd love to hear, about the types of conditions you treat and really the types of patients that you typically work with.
So, Zach, I see from, basically 12 years old all the way up to 100 years old. So, athletes are multiple ages. We try to keep people as healthy as we can within the parameters. I am non-operative, so I do not operate. I've been a physician for over 20 years, the last 6 years with OrthoVirginia. My really significant specialty is ultrasound imaging. I'm a registered diagnostic medical sonographer. So I've taken not only a sports fellowship, but I've also taken the next step and got certified as a sonographer, specializes in imaging and imaging quality, sort of real time under guidance. It allows me to be more precise with my injections. It allows the patient to have a less painful experience. I don't have to hunt and peck for the joint. I can see it directly. So that gives us a lot of good details, and a lot of the stuff that I do is dynamic. So when people move, it's not in one plane. It's in multiple planes. So ultrasound allows me to look at the multiple planes. If I need to evaluate a shoulder in a certain position, elbow in a certain position, knee in a certain position, hip in a certain position, I'm able to do that real time with feedback from the patient, and seeing if we can demonstrate the problem or elucidate a little bit further what we would need to do. I see anywhere from weekend warriors to young athletes to professional athletes. I see the range of things from basically head to toe. Don't really do spine beyond the age of about 55, because that's sort of more specialized, but definitely see spine earlier, where we can do a little bit more interventions in the office.
Sure, I love that. Well, and I appreciate that perspective. And you mentioned towards the end there, right, you see the weekend warriors, the young athletes, and obviously, especially with training camp on the horizon, the professionals as well. So it's a pretty unique perspective, right? I mean, all very different people. What are some, like, I guess, differences and similarities that you see in the types of, whether it be injuries or even just the presentations amongst those like different populations?
Absolutely. I mean, you know, right off the bat, professional athletes, they are uh, very unique. They are just specimens. These guys, and I've taken care of women on the women's national team for soccer as well as the WNBA. They have a special set of collections of genetics, training, and just plain old hard work that is unique to them. They're like top 1% of the population. They respond to things much differently than you and I would respond to things, because they have a lot more fast twist, fast twitch muscles than we do. That's the way they've been trained. they tend to have injuries that are more muscular related because they generate so much force, that they get a lot of hamstring tears. Especially you'll see that, coming out of training camp, you'll hear about, oh, this athlete's out 2 to 4 weeks because of hamstring tear. That is a very common injury we see, especially in training camp, because they're just so dynamic. And until those muscles get trained for a little bit more of a constant load, they tend to tear their muscles more, and it's more an acute injury that responds relatively quickly for them. Now, younger athletes, I would say they don't necessarily tear their muscles very often. What they do, and especially in Northern Virginia, it's overuse. It's a lot of overuse stuff. It's a lot of stuff. Kids under the age of 16 don't have closed growth plates. And one of the difficulties I have is trying to explain to parents that they can't go to every showcase. They can't go to every camp. They can't go play on club team, travel team, and high school. That's just too much load for these young patients, that their bones are still growing. Their muscles will tolerate it. But what happens is where their muscles and tendons attached to the bone, that's where the problem lies. And once you start getting that bony edema in there, then it's like a shutdown for a considerable amount of time. And that's where I think some of the younger athletes, and I know, Zach, you treat a lot of these too. It's kind of frustrating for them, as well as us, because it's like people are like, well, can't you fix it? I'm like, it's time. It's time. It didn't just happen. It's been building over time. And, as when, me and you grew up, we didn't play on 3 teams at the same time. We took the summers off. We had 2-3 months of rest between seasons. That doesn't happen now. It's 365, 7 days a week. And, sometimes I think it's to the detriment of our, young athletes. And it's definitely a cautionary tale that I tell, parents, like, look, I understand you don't want them to fall behind. There's a lot of pressure. You got to go to all these tournaments. Work on strengthening. You don't have to work on the skill set every time. Work on strengthening, work on core strengthening, hamstrings, those types of things where you can stabilize your pelvis and core and your hamstrings. It's just so key. ACL tears, biggest prevention, as you know, Zach, and you're smiling, hamstrings. Hamstrings. Your hamstrings are weak, which you will not get strong hamstrings from playing games. That just won't happen. You've got to work yourself and get them. So an ACL injury is devastating for a young kid. And it has repercussions down the road, years down the road, because we see these patients not as a kid, but also as an adult. So those ACLs, even when they're repaired, and they're repaired by fantastic surgeons that we have at OrthoVirginia, even if it's done perfect, that's still a big injury. There was bones that shifted. There were generally meniscus injuries that happened. If we could prevent that by strengthening, and one thing, one specific thing that I really try to tell all my younger patients to do is there's a great strengthening program. It's a 20-minute strengthening program. It's called FIFA 11 Plus. It was designed by FIFA soccer, and it has been proven, statistically proven, to decrease ACLs and injuries up to about 50% compared to a study group. And it has to do with a warm-up, which is muscle activation. It's not just, doing push-ups or jumping jacks. It is involved muscle activations, your core, your glute medius, your hamstrings, activating these muscles, doing dynamic activities, which are responsible for warm-up and allows you to perform as an athlete in a good manner, helps with strengthening, and it can make a huge difference to an athlete. And then I think lastly, weekend warriors, Definitely see a lot of them, and there's nothing wrong with it because I'm a weekend warrior. Love to play tennis. I'm a big water skier, wakeboarder. I love to do those things. But the biggest thing I see with weekend warriors is the arthritis builds up in us, whether we like it or not. We are consumable products. Our cartilage doesn't last forever. Our tendons don't last forever. Our joints don't last forever. So people always come to me and say, this just happened. My knee just blew up. And you look at the x-ray and you're like, this has been going on for a while. But that's where we sort of get into, the strengthening. You've got to put your homework in. Runners, long distance runners. I ran 4 marathons. I love running. But if you don't do the homework, if all you do is run, you are not building muscle. You've got to give yourself even recovery days. Do some Pilates, do some strength training. You've got to build in 1 to 2 days of recovery and strength building. It will make you a better runner and it will prevent injuries.
I love that. Oh, I appreciate that. There's so many good things you said there around just the different populations. And one of the cool things I kind of picked up on was, and this was maybe in line with like some of the recommendations you gave for the weekend warriors, as well as the high school, or like I say high school, like youth athletes, in that I always think of the concept of like movement variability. And that seems to be a common trend between both. It's like, okay, if you're doing this same thing over and over and over again, that's a little bit of a recipe for something happening. But hey, can we add something in the form of just strength training, different types of movement skills, just to make us a little bit more well-rounded and not necessarily always beating things up in the same way over and over again? Obviously, there's specifics in regards to, whether your growth plates are open versus are you fully grown and that kind of thing. But that's a really cool way to kind of think about it there. And one question I had, something you mentioned about the youth athletes there. You had mentioned, when I'm thinking of I know the parents of the youth athletes you work with that are probably watching this. You mentioned about that like edema that sets in. And when finally like the sort of, I almost think like maybe like the smoke detector's been going off for a little bit in the house and now the house is finally on fire. When those symptoms are present and very obvious and slapping us in the face, at that point, is it almost too late at that point in a way? Or and I kind of asked to say like, okay, at what point, if you're somebody watching this and you're a parent, are you like, maybe now, when do I really need to get my kid into something like a strength training routine, like the FIFA one you mentioned, or something like that?
Zach, fantastic point. One thing that you said is movement variability. I cannot stress that enough. You've got to test your strength, not in a straight line, but nothing really happens in a straight line unless you're a marathoner, right? Soccer, basketball, softball, baseball, tennis, pickleball, everything is dynamic. So you've got to test your muscles in more than one plane. And when you sort of build this up over time, I like the smoke detector analogy, because kids will start complaining. They'll be like, my back's a little bit sore, or, I'm feeling a little something in my hip or my foot. It's a little sore. That's at that first episode, you need to start thinking, okay, how many games is he playing in a week? How many hours is he on this or she on this? And, is there a sufficient break to allow the regeneration of the muscle tissue, the bone, to sort of replenish those areas? Because kids are amazing healers. But if you get to the point where the 4-alarm fire is going off and you have a stress fracture, that's where you just got to shut them down. And it is exceedingly difficult to get to that point. And you asked a very poignant question, and I don't know exactly when that point exists where you say, okay, something's wrong. I think if it becomes constant and that if he has a break for a week and she's doing well. And then you go back and she plays a game that following week, and all of a sudden it's right back. But then she's off 2 to 3 days, feels great. And then she goes back. Oh, it's coming back at the end of practice. So you'll see that load. As that load goes up, especially with stress injuries, that's when they feel it. When they, if you rest for a week, 2 to 3 days, feels great. They're like, oh, I'm fixed. Well, not really. And if you notice this pattern that every time that their load goes up, you're getting to the point of you're pushing like stress reaction, stress fracture. And that's when we started got to add in some strength training, some variability, those types of things.
God, that makes a ton of sense. And I loved one of the things you said there, where I loved a lot of what you said there, but one of them was, pain may come and go a little bit, but it doesn't necessarily mean we're always out of the woods. And I know I try to talk to a lot of a lot of my team does, a lot of our patients, the kids, whoever, that, sometimes, especially in the rehab process, that pain, can be in many cases relatively easy for pain to help us make the pain go away. And that's just almost like when it's actually starting as opposed to when it's done, because, if it's going on long enough, or, there's probably a reason why it developed in the first place. And then we got to kind of be a little bit of a detective and kind of figure out, hey, why is that? And let's make sure that we create a little bit of more of a loading tolerance or tolerance to stress, so that we have some room for error. So the next time we go back into the activity, it doesn't happen again. And, especially, I'm sure you see this you mentioned it with your high level athletes. I mean, you're talking elite athlete, and this applies to really high level youth athletes too, because if you're really, really good, you're looking to play in college, you can probably do a little more than the average person your age. So maybe you can generate forces that are higher. So, you may be predisposed to injuries a little bit because you got a big engine, and, and you got a big, powerful engine. There's, they got to go into the shop sometimes. And so we got to do some quote unquote preventive stuff in the terms of strength training, that kind of thing. So I love that perspective. And it's funny, I always think of the analogy or the example, I should say, when you talk about the athletes that can generate a lot of force and they're able to have unique injuries because of it. The one that always pops into my head is, back, it's not a muscular injury, but when like Bo Jackson dislocated his hip. And I will tell people, like, he's a great example. I'm not strong enough to even to do that to myself. But sometimes, it's unique. And you know what? If you can generate a lot of power, you got to be able to control and sustain all of it. So it's for anybody watching and has a youth athlete, especially if they have big aspirations, it may be worth getting into some kind of a routine like that. I definitely am going to put a link to the resource that Dr. Antonis, you mentioned. So one thing too, as I know, with your perspective, you have obviously you're not a surgeon, so you don't do surgery. So for a lot of, I know, patients I talk to, a lot of times the traditional way of thinking is, okay, if I need to go to an orthopedist, that means surgery. And so how does somebody know whether or not they should come see you versus maybe like more somebody has a surgical approach or anything in between?
I don't think there's a wrong answer to either way. A lot of patients I see, they're like, they'll come into me and they'll be like, well, I'm not getting surgery. I'm like, okay, that's start off at, and that's fine. And sometimes, generally 90% of the time, there is no rush to surgery, right? I mean, this, Zach. You can always try some rehab. We can try some injections. We can do some further imaging. There's very rare times where you have to go to surgery right away. The one that I could think of off the bat is like hand injuries. I mean, if you snap a flexor tendon or extensor tendon, you really need to see someone relatively within the first week or so, because that is something that is time dependent. Same thing like patellar tendons with the knee, because the longer that you wait on those, biceps tendon in the arm, the upper arm, those things, when you see something like that and it was an acute pop, that's usually something that needs to be evaluated a little bit quicker in a surgical capacity. That being said, I mean, I'm in a group with over 30 orthopedics. So if you come to see me and you just happen to guess the wrong way, I got about 30 people I can call and get you in and seen the next day. I don't want people to stress about that or to worry that one of the orthopedic guys, just because they do surgery, they're going to say, okay, I'm going to take you to surgery right away. Most of our guys have the experience. Dr. Annunziata being one of them. Dr. Grossman, as she continues to, work on her career. They learn what they need to push and what they can say. Okay, we're going to try rehab first. We're going to try strengthening first. And a lot of times I get a lot of referrals, and they'll be like, okay, why don't you see, non-op guy first? Dr. Antonis is my partner. He does PRP. He does gel injections, steroid injections under ultrasound. These are things that are options for a lot of people. And that's where, sometimes people feel more comfortable in the fact they come to see me first, and I'm not going to push surgery because unless I see an absolute indication, there's no reason to rush 90% of these patients.
I love that perspective, and it's really cool. And through my experience working with OrthoVirginia, your practice, is that there's a lot of different ways that you seem to have available to help your patients. So obviously we see things at our practice from the rehab perspective, but we send a ton of our patients to OrthoVirginia, because what I find pretty cool is that, all right, if it's an obvious surgery, then great, you have the experts to be able to do that. But hey, that's definitely not the immediate thing that's recommended in most cases. And then it doesn't just mean like, okay, sorry, too bad, we can't do anything to help you. There's a lot of things in between, like Dr. Antonis does, whether that be, like you said, the PRP injections and, gels and all kinds of things that you're able to do that, again, don't require surgery and you have done right in the moment. So that's fantastic. And speaking of some of these things that maybe some people haven't heard of, my last question for you is really, and I just love hearing this from other passionate providers, is, what types of things are happening sort of in your field that is, really exciting you these days?
So, a couple things here, Zach. I mean, wearable technologies, I think, are amazing. These are sort of the undershirts you'll see on some of the athletes. And like every once in a while, you'll see like an athletic trainer pull like a little black clip out of them. And what they are basically is a tracking device. And what they do, when I worked with DC United, and we also do this with the Commanders, they're accelerometers. So they see what the speed vector is, what was the fastest speed they achieved during that practice game, what is the highest they've jumped, how many miles did they run, what was their biggest load. It is amazing. And also they can track heart rate with these, and you can make all these correlations based off this wearable technologies, and they're becoming cheaper and cheaper and more readily available for the general public. And I know this is a controversial term, but like when you start talking about workloads and veteran days, like veteran days off when you've got a little bit more of the experienced athlete, these wearable technologies can provide tremendous amount of data, because we can watch these guys at the beginning of the year, their speed will be here. And then as the year goes on, the speed starts coming down. And it's because it's wear and tear. I mean, it's wear and tear. This is what happens. Even to the elite athletes, their speed comes down when they're overworked. And what you have to watch is when their speed starts getting below a certain level, they are significantly more injury prone, because something's going to give. When they can't reach their peak velocity, when they can't reach their peak speed, and this is the same thing in younger athletes, when you notice, hey, he was able to outrun that guy before, why can't he or she outrun that person? Well, you may be talking about overtraining. So these are things that we can really watch now a little bit more ideally in a little bit more uh, quantitatively rather than qualitatively. Quantitatively, means more specific numbers. Qualitative means, well, they run this fast and they're faster. She's faster than she is, but then now they're sort of equal. Something is changing. Um, and along those lines, I think force plates are something that also is very interesting, where you actually can, watch somebody jump, test their hamstring strength, and watch it change over time, um, to allow an athlete to get better, to see the difference between the right side and the left side. I can't tell you how many people that I see where I can just tell by manual testing, and same thing with you, Zach. Their right side and left side, it's like night and day. And you're like, you're not trained them equally, and you're more predisposed to injury when one side's much stronger than the other side. I mean, our goal with professional athletes is less than 5% difference between the right side and the left side. And it's difficult to achieve, because people are more dominant on their right side or left side. But don't be afraid to train on the non-dominant side, because it will help your dominant side as well. The other thing that I'm, have been really interested in is, PRP, platelet-rich plasma. It's been around forever, but now we're sort of getting really into the nitty-gritty of what particular part of the PRP are we using? Are we using the platelet-rich plasma? Are we using the platelet-poor plasma? Or are we using one of the newer molecules that they found? And most of the studies of this is done out of LSU, regarding what they call A2M, which is a macromolecule, alpha-2 macroglobulin. It's a large plasma protein that they're finding. It's in PRP, but there's another step you can take to further filter the PRP to get to the A2M. And they believe that as we get more and more data on this, the A2M is sort of better. It's the part we think is most productive of the PRP, and you're trying to get that particular portion. And then not all PRP is created equally. So when people say, "Oh, I got PRP," and I'm like, okay, not all created equally. There are different systems. The system we use is the same system I use on the Washington Commanders, because you're trying to get a specific concentration in there of platelets, and there's a magic number, and our systems continuously get that number so that I feel comfortable treating a 16-year-old athlete as well as a professional athlete with PRP. And even as we sort of work into the as we call the masters athlete, PRP is still very good for them. PRP A2M does not grow any cells. It does not regrow cartilage, does not regrow any kind of tissue back. I used to do stem cells. And when I say stem cells, more mesenchymal cells is what we call them. I used to harvest bone marrow, and I used to do fat adipose deposition. And those are more expensive, more involved. But I stopped doing them about a year and a half ago, because the expense was not worth the difference in price. A lot of the bone marrow, a lot of the fat is about $5,000, and PRP, is considerably less than that. And we charge $825. But I was getting the same results with the PRP versus the fat cells and the bone marrow cells, which, people say, well, they're the stem cells. Yeah, none of those cell lines have ever been proven to grow anything back. Are they anti-inflammatory? 110%. They decrease inflammation, but if you don't do therapy strengthening with PRP or any of those other products, you're not going to get anything to grow back. It's all about recruiting the muscle, recruiting the other muscles around that area, balancing out your structure. Really helps.
I love that. I appreciate that perspective so much. I love the passion more than anything that really comes through clearly with what you do. And obviously, the just depth and range of knowledge is awesome. Like even just starting off on talking about, just some of the different like sports technology that's available and useful, getting into things as nitty gritty as different types of PRP. Like that's so cool to hear. Love so much of that. And love to hear your expertise on those areas. And it's cool to see where that overlap is, because it looks like we're both working with things like force plates and stuff like that. I know we have them at our practice, and you guys, I know, definitely do with the Commanders. So that's really cool to hear you guys utilize that. And yeah, I could talk to you all day about this stuff. Honestly, this is amazing, but I know you're busy. You're getting ready for training camp coming up soon. So you need your rest. But for everybody watching this, like I said, I can't recommend the folks at OrthoVirginia enough. And obviously Dr. Antonis here, and you've seen some of his colleagues on these interviews before as well. So what I'm going to do is below the video, you're all going to see a link to their sites. You can easily find them. But I'm sure all you guys can figure out how to use Google as well. If there's and of course, like I said, you can always call in and they'll point you in the right direction. So with all that being said, Dr. Antonis, I really appreciate you joining us today. And good luck this season.
Yeah, it's going to be a good season. I have a feeling that we've got some young, youthful players this year. It's exciting to see them and see them shine. And I'm really hopeful we're going to have a really good year. Working with the coaches and working with the players, there's a brand new energy there, and it's exciting. Very excited for the start of the year.
Awesome. Well, I can't wait to see what happens. And we'll look for everybody to stay healthy, because I know you'll be taking care of them.
Absolutely. I really appreciate you, Zach, having me on. And, I always feel very comfortable when I send any of my patients, either in the Bethesda or McLean location. You guys take good care of them. You let me know if something's not matching up. So the fact that we communicate back and forth makes a huge difference with these care plans, because they can change, along the way. You guys see them a lot more than I do. So you provide a lot of insight to me, and it's really been a beneficial relationship, and really continue to look forward to the collaboration with you, Zach.
Oh, well, appreciate you saying that. And the pleasure's all ours.
Absolutely, Zach.